Let me get it rolling and make sure it's recording. Okay, we're recording. So thank you so much for coming. Thank you, India, for joining us. I'm Lisa Fox with National Center for Pyramid Model Innovations, and we also have Erin Barton. So, Erin, your video went away. Are you still there?
Oh, I'm still here, yes.
Oh, there. I guess just when we talk, our video shows up. All right. I suppose. So what we're going to do is we have this event to really help people understand the application and the application process. This will be on the website, so we'll get it up in a day or two so you can go back and look at it or share it with other team members as you're writing your application. What we're going to do is talk about what's involved in intensive TA, kind of what this is all about, the requirements of the application. We already have received a lot of questions, so Erin and I will give some of the answers to the frequently asked questions and then talk about what will happen in the submission of the applications and notification of who was selected. So our goal in intensive TA is to put a lot of our NCPMI resources to build the capacity of the state. So for this initiative, it means that Erin and I will be working very closely with the states that are selected to have them to work to a place where that state then will have the capacity to do training in pyramid model. So we'll do that with you and train people within your state to continue that training and leave the materials with you. We want your state to have the capacity to support people in their implementation, and we know in a Part C system that will look different depending on the state you're in, and we can talk about that a little bit. We want to ensure that you have coaches who are able to coach the practitioner. And so we're going to talk about that distinction. Of course, we all, in Part C, family coaching is what we do, but this is about coaching the practitioner in the evidence-based practices that we're implementing with the pyramid model. And then we, at the state level and at the practitioner level, at the implementation level, we want to use data for decision making. And so we'll bring those tools and help you use those tools and hopefully continue to use those tools as you scale up. And so as I've described, this is a lot. We will be committed to the 2 states that we're selecting this time for 2 years to make sure that when we're done that the state has the capacity for all of these pieces. So before I get into unpacking the application more, I wanted Erin to talk about what does this really mean to bring the pyramid model to Part C early intervention services. People are pretty familiar with it and are probably more commonly familiar with the classroom application. So we thought it would be worth it to just address this briefly so that you understand what we mean by it when we talk about in Part C. And I'm giving you the keyboard control, Erin.
Okay.
So
did it switch over? Sorry, I don't.
Yep, you're in control now.
There we go. Sorry. I didn't have full screen. Sorry. Okay. So
you jumped to slide. Yeah.
I did. Okay. So the pyramid model, as Lisa said, we've thought quite a bit about how this applies to families involved in the Part C system. And it is different from how it works in classrooms, but a lot of the elements are very similar or the same to how it works in classrooms. So what our overarching goal and kind of the overarching guidance that we provide is how to make sure that we support families in supporting their child's social emotional competence and their infants and toddlers' social emotional competence. So our goal is really to support and coach practitioners to then support and coach and work with families to ensure that families can enhance and support their child's social emotional competence. So it's the tiered framework is essentially the same, but it looks a little bit different because we're talking about homes and we're talking about families as the unit, as the place where services are provided, and families are the people who are receiving the services then to support their infants and toddlers' social emotional competence. So as I said, the tiers are the same, so it's still a tiered approach where we really think about in the first tier, what are the strategies and supports that all families need? We think about universal screening so that we appropriately identify families and children who need social emotional supports. And then we think about what are the practices? What are those universal practices that all families need? And then we also think about families who need, and children, infants, and toddlers who need more targeted supports, who might be at risk for social emotional challenges, including caregivers and families who might need additional supports. And so we have some practices and some ways of supporting families that involve targeted supports. And then the tertiary level or intensive level is for families who need more intensive supports, and toddlers at this level who have persistent challenging behaviors, who need a functional behavior assessment. So the way we think about tertiary supports is the same as how we do in classrooms, in that we use a function-based approach to identifying why the challenging behavior is occurring, as well as a preventative approach, such that we support families in using practices that both prevent and reduce the challenging behaviors from occurring. We really focus on supporting early interventionists, so the overarching support is provided to early interventions and interventionists. So we are going to help states develop or enhance systems of professional development that support the early interventionists in learning evidence-based practices to then support and coach families who have children who are involved in the Part C system. So it's really focused on supporting practitioners who then support families in enhancing their child's social emotional competence. The important thing, and one thing that we want all states to recognize, is that the pyramid model aligns with many popular and many other evidence-based approaches to home visiting or family coaching. So we are very much routines-based. We are very much family-centered. We're going to talk about that, but we are not going to ask you to replace, for instance, routines-based interviewing or routines-based intervention if you're using some of those other common evidence-based approaches to early intervention or home visiting. What we're going to support you in doing and thinking about how you can use the pyramid model to enhance those programs. And we really want to make sure that states understand that message, that we're not going to ask you to replace any of those things that you have existing, especially when they're working really well, but we're going to help you figure out how to make sure that the pyramid model can be used to maximize what you're already doing, to make sure that families have the support they need to support their child's social emotional competence. And so I want to highlight this figure that a colleague and I, Angel Fettig, created a while ago, because I think it highlights how we will support the pyramid model and how we will support states in implementing the pyramid model really well, in that we are going to support early interventionists in supporting families in using evidence-based practices to then support infants and toddler social emotional competence. So it is multi-layered in that our goal is really to make sure that early interventionists who are working directly with families have the supports they need to then support families in supporting their child's social emotional competence. And that's really where the family coaching comes into place, and that's really what we're going to support early interventionists in doing. Our coaching is the model of coaching that we use to support families is support-based. And we really focus on the fact that it's families and caregivers who influence children, and it's early interventionists who then work with families. We also recognize that children learn across the day, and they especially learn when the early interventionist leaves. So they learn in the context of their own families' routines and their own families' activities, and that's why the family coaching piece is so important. So we are going to support families in supporting their child's social emotional competence. And we really think about maximizing intervention such that we're not thinking about intensity of services as being the number of hours that the early interventionist is in the home, but rather it's the ways that the early interventionist is supporting the family in making sure that they are providing learning opportunities across their routines across the day as makes sense for their family and based on what the child needs. And this slide really just highlights that we do also have a approach to guiding families who have children with more severe challenging behaviors, and we particularly think about toddlers at this level. So if we have infants who have severe, persistent, challenging behaviors, that often involves a medical referral. But if we do have toddlers, and there are toddlers who have severe and persistent challenging behaviors, then we use a function-based approach, just like we would with older children and just like we would in classrooms. But it's also support-based. So we are supporting families in using prevention strategies and teaching their children, their toddlers new skills, and in using strategies that make it less likely that the challenging behavior continues to occur. And we use a family-centered approach. And so the specific approach that we use is Prevent, Teach, Reinforce, which is highlighted in this book that our colleagues and Lisa have written. And now I'm going to turn it back over to you, Lisa.
Well, before you do, India, do you have questions for Erin about what it means to bring the pyramid to Part C programs? Or
no, I don't have any questions at this point. Thank you.
Great. Thank you. So do I have control now? So the intensive TA, so what we provide is 2 years of intensive support. There's a state implementation guide on the ECTA website that really describes components of implementation and scale up, and the components are a state leadership team, a professional development network of program coaches, and implementation sites. Well, that means we need to do a little bit of translation for figuring out how that fits with Part C service systems. So at the state leadership team level, if you're in a state that already has strong collaborative relationships with 619 and other key partners, your state leadership team may be large and have multiple collaborative partners who are invested in bringing the pyramid model to early intervention services and maybe expanding it or connecting it to work that's already going on. However, you might be in a state where those relationships aren't there yet, but you very much want to bring the pyramid work to your Part C work, to early intervention services, and your leadership team might be smaller and more closely held. So it might be within the agency that is the lead agency for Part C services. So it really, our goal, Erin and our goal is to help Part C programs figure out where they fit and how to make this work. Regardless, you have to have state leadership. So one of the things we're asking you to do is to identify that team and to have state leadership to guide this very intensive work and to work in partnership with us to do that. The other component that's really important is a professional development network, and we call them program coaches, yet I know that word sometimes doesn't resonate with Part C if you don't have programs that are local implementation entities or agencies. But the goal about a professional development network of program coaches is we want to help the state have people within that state who can continually help practitioners implement the pyramid model. And so our focus is on building the capacity of those professional development network program coaches, so they have the capacity to continue to scale this in the state. And so we'll talk about that a little bit as well. But our main focus are those people, who's going to train after we leave, who's going to guide implementation, and who will lead it at the state level. We'll provide both on-site and distance support to the state leadership team. So we'll come and guide meetings. We'll also meet with the coordinator monthly as they go into a meeting. The leadership team should meet at a minimum monthly. And we can always help you build the agenda and reflect on what happened in the meeting, as well as be at some of the meetings, especially early on. We'll also provide on-site training, so we will come and train practitioners. We will train these program coaches. We will train practitioner coaches, so those folks who are actually coaching the early intervention service providers. We will train them in how to do that coaching, and how to collect data and continue with Fidelity, the coaching model. So that'll be both on-site as well as distance support. And then we'll bring our data tools and evaluation support as you figure out how to integrate those tools into the work that you're doing. We do ask that the application be submitted by the Part C coordinator. We are asking that your leadership team, even if it's small, that you include a family rep. And a logical place to go is to the parent information training entity in your state that's funded by OSEP, or in a community parent program funded by OSEP. If for some reason that is not where you would go for a family rep, there may be another organization, and you could include that organization in your application. But we very much want to engage the PTIs who see so many families and can really support this work in a robust way, in the support that they're providing to families. We're asking that you realize that something like this costs money. We don't want you to give us the $20,000, but you need to be able to allocate. We're thinking at least $20,000, so that you can cover the things that can get in the way of implementation. So that you could cover, perhaps, to support people's travel to a central location for training might be a cost that you have. You might find that you need to purchase materials for practitioners, could be a cost that you have. So we want to make sure that you're not on such a thin budget that if there was a cost involved in something, that your inability to meet that cost means that the initiative doesn't move forward. We also ask that you commit FTE to implementation, and I've actually encountered a few frequently asked questions around this. Folks who've said, you know, we already have invested heavily in FTE with a technical assistance provider, and so you want us to have additional FTE. And my answer to that is no, not necessarily. What we want is FTE committed to this initiative. And so we want part of a state person who's going to lead those state team meetings and be on the phone with us monthly and make sure this initiative happens. We want a part of someone who's going to make sure that all the professional development events happen, that data are collected, that people who are doing implementation coaching have guidance and support to be able to do that. If that is somebody in a TA entity that you are already funding, and you can carve the FTE across these people, and they have explicit role definition around the pyramid implementation, then you can use those existing people. We're not suggesting that you go and hire somebody, but what we're suggesting is that it takes collectively about one FTE, and that you need to have that level of commitment to make this work. So as you complete your application, we're really looking to see that you've been thoughtful about being in it for the long haul, and that commitment to the implementation is evident in the narrative of your proposal. So I've gotten questions about, well, people get it. The state team and a professional development network of program coaches makes sense, and these implementation sites. But what if we don't have that? And so how do we navigate that as a Part C system in our state? And so I created this slide, and I hope it's helpful to kind of help us think what the options might be. So that professional development network are people who have skills in training and technical assistance who guide leadership teams to make sure that there's high fidelity implementation. And in classroom-based programs, that's kind of easy because there's a place where these classrooms exist, and so leadership teams are at that level, either at a district or at a program level. The implementation site then has its own leadership team, and those teams really guide implementation. They make sure practitioners get coaching. They work hard around family engagement strategies, families knowing what we're implementing and why, being a part of the decision making. They make sure that kids who need behavior support get behavior support efficiently and that it's done with fidelity. And they use data tools to make sure all these working parts are there and in place and working within a program. And so those leadership teams really ensure that fidelity is happening by individual practitioners, but also across practitioners. So yes, we are aligning our program services to the pyramid model and making sure that all the features are in place to make that work. So what happens if you don't have sites? So what if we don't have a place, but we have practitioners, early intervention service providers who are supporting families who are supporting children? We still need to make sure, and I don't know how to get around the training and technical assistance professionals. The state, you know, if all you have is a state coordinator and early intervention service providers and nothing in between, it would be really difficult to figure out how to get an innovation in place in all of your programs. And if we don't have the sites, then we don't have the leadership team guiding implementation, coaching, behavior support, planning, and family engagement. So one way that could be possible, if it's possible in your state, is to pull that up to the training and technical assistance professionals. And so they, in essence, would take on what typically is at the implementation site. So not only would they coach practitioners and train practitioners, but they'd also think about those broader pieces of ensuring family engagement, making sure that behavior support planning happens, and guiding data for decision making. So that might be one way to look at it if you don't have programs or agencies providing the support to practitioners. We can also discuss other options as systems are uniquely constructed. So I'm going to pause there. Indy, do you have any questions about that?
No, I'm just taking lots of notes.
Okay, terrific. So questions have popped up. We have some of our frequently asked questions that have popped up that I think we'll run through and answer and then see if there are any more questions. I think, Erin, you've got the first one. First two.
Yeah. Yes, so we've had many questions related to, will this integrate into our primary service provider, family guided routines-based intervention, routines-based interviewing, so the various models that currently exist within Part C programs. And absolutely, as long as it's, you know, an evidence-based, evidence-informed model, then absolutely the pyramid model can be integrated into these programs to, in fact, enhance. That's the purpose, right, of this innovation, is to really enhance and maximize the supports that practitioners are able to provide to families who then will enhance their child's social emotional competence. So the answer to that is absolutely. The second question is a question we've received a couple times, and also something that we've thought quite a bit about. So the question is, what is practice-based coaching, and does that replace the coaching that we already have in place that our practitioners do? Practice-based coaching is an approach to coaching primarily for classroom teachers and professionals. The way we think about coaching families is that we use practice-based coaching to coach the practitioners, who are then going to use a family-centered approach to coaching families. So practice-based coaching is part of it, is absolutely part of how we coach the other professionals or the practitioners who are then working directly with families. But we don't think about using practice-based coaching with families. It's a different approach to coaching, a family-centered approach to coaching. And Lisa, I think you're next, right?
Yep, I am next. So the third question, we get a question of, we're working with so-and-so to implement and scale up a family coaching model. Can we do this too? And I think that answer's a little more nuanced. If you're very engaged, I want you to think about kind of the time available that you have at a state level. If you're highly engaged in rolling something out and a lot of training effort is going towards that, and that's your primary focus, I would probably encourage you to wait till you get that in place and come back to us. We'll be offering the application in 2 years. This is going to be a lot. The other option might be if you're working within some regions around this, and maybe you've got one region already well established using a family coaching model, but you want to influence social emotional outcomes, you might then do pyramid implementation on top of that. But I think I know systems are really strapped for time. Early intervention providers have very limited time for professional development. So you really need to think about that as you jump into something as intensive as what we're proposing that you do. We've had questions about, well, what we really want to do. We hear you talking about bringing this into early intervention services and with a primary focus on home visiting. But what we really want to do in our state is birth to 5, and we really want to bring it to our classrooms, birth to 5, 619, and Part C. Oh, goodness. I don't know how I don't know how that happened. And so this probably, we have another RFA coming out for intensive TA in October. And that would be much more focused on the birth to 5 all systems. We wanted to offer this to Part C in particular because so many Part Cs have social emotional in their SIP and are doing this work. So if you want to do birth to 5 intensive technical assistance scale up, I would say look for the next intensive TA application that's coming your way. And then question 5, we're very deep into the implementation of our SIP program improvement strategies, and will this fit with our state goal and activities? If you're focused on the social emotional outcome and you've begun to do some activities and you see that it fits, I mean, I think only the state can make a decision on whether or not implementing the pyramid model will align with their program improvement strategies. I think many of the states and the SIPs that I've seen, the pyramid model would align and be helpful and give you your quote it of what you want to get established to address kids' social emotional outcomes, but really that decision is yours. Erin?
Oh yeah, so the training content is focused on, as I mentioned, it's focused on supporting families and supporting their child's social emotional development. And so we focus a lot on, in the initial modules, we focus a lot on what social emotional development is for infants and toddlers. We focus quite a bit on strategies then to effective family coaching strategies. So we talk quite a bit about what are evidence-based practices related to coaching families. So we talk a lot about effective communication strategies. We talk quite a bit about using performance-based feedback with families. We talk about setting up opportunities for practice. We talk quite a bit about supporting families embedding into their daily routines. And then we also spend a good deal of the training content talking about what the practices are and what are we going to support families in actually doing in their homes with their children. And it does align with the Division for Early Childhood recommended practices. You might know, if you're familiar with the DEC recommended practices, there are different topical areas. So there is a family area, there's an instruction area, for instance, there's an assessment, and there's an interaction and leadership. And the practices that we are going to talk about, the training content aligns with practices within each of those topical areas. So there are many, if not most, of the interaction topic are practices that align with what we're doing, and in fact practices that are embedded into our training. Multiple of the instruction practices, and of course the family engagement practices. So the DEC recommended practices absolutely align and are embedded into the training content in multiple different places. And they are evidence-based practices. So there has been especially in the past few years, research on family coaching and how to support families in homes related to behavioral supports. And, there's been research conducted on this for many years. So these are evidence-based practices that we're using to support home visitors and early interventionists in their work with families in the homes. The next question is, you have home visiting services emphasized on the web, on our website, and early intervention personnel also support children in childcare, infant toddler programs. Does that mean you can't address those settings? Absolutely, no, it does not mean you cannot address those settings. Sorry about the double negative there. We absolutely recognize that early interventionists are also working in centers, not just in homes. We are primarily focused on how to bring this into homes with families, but we're also going to support states who have early intervention providers working in centers. Think about how to enhance that and how to bring the pyramid model to those early interventionists who then can bring it into centers. So although we're not talking about a center-based approach in this innovation, we absolutely recognize this, and it wouldn't preclude you from applying to this TA option. We absolutely will support states in thinking about how to enhance that support.
Great. Any additional questions about any of those or our answers? All right, well, so to wrap up, the applications are due towards the end of September. We'll notify states the week of October 8th. We have to make sure OSEP is okay before we dedicate resources for everything that we do. That is a major project decision. OSEP is our funder, approves those decisions. So that's why I can't give you a date definitive, but our aim is to notify states the week of October 8th. We will not select more than 2 states. So we can do 2 states this round, and if states aren't selected or if states aren't quite ready for this yet, we'll be offering this again in a little less than 2 years. It'll be open again for people to apply. Once the states are selected, we're going to aim to schedule a planning call for October, and then we'll begin that work. And that work really will move at the pace. We'll be always pushing the state to move forward, and we have a really big agenda for the state, but we'll also spend a lot of time learning more about you and your context and how to make sure that what we do will result in sustainable implementation. Any additional questions? Because that's really all we had to share.
I do not have anything, Lisa and Aaron. Thank you so much for going through all of this. I took lots of notes, and I will refer to the slides as well.
Great.
You guys.
Terrific. Thanks for joining us. So we will post a recording probably within the week so that you can share it with other team members as well.
Sounds good. Thank you so much.
Great. Thanks, everybody.
Thank you.
Bye-bye.
Bye.